Right now, somewhere in your skull, a headache is building. Maybe it's from your screen. Maybe it's from stress. You reach for a pill. You wait for it to fade. That's the whole ritual. 30 seconds of effort for a problem that's been haunting your species for tens of thousands of years. But here's the strange part. Long before medicine, before writing, before the wheel, humans already had a cure for a splitting headache. And it wasn't gentle. It involved a sharpened stone. And a hole, drilled directly into a living human head. You'd think that would kill someone. Often it didn't. Let's go back, way back, tens of thousands of years, to a time before anyone understood what a brain even was. Your ancestors didn't have a word for neurons. They didn't know about blood vessels swelling or tension building in the muscles around your skull. All they knew was pain, a pressure behind the eyes, a pounding that wouldn't stop. And when something hurts that badly, without any visible wound, without any obvious cause, the mind reaches for an explanation. So they built one. Something was trapped inside the head, a spirit, a demon, bad blood, pressure that needed release. And if something is trapped, there's only one logical solution. You let it out. This procedure is called trepanation. It means cutting or scraping a hole into the skull while the person is still alive. Archaeologists have found trepaned skulls on nearly every continent. Some are over 7,000 years old. And the truly remarkable detail isn't that people attempted this surgery, it's that many of them survived it. How do we know they survived? Bone tells the story. When a skull is cut while a person is alive, the edges of the wound begin to heal. Smooth, rounded bone forms around the opening over months, sometimes years. Archaeologists studying ancient remains can tell the difference between a hole that was made after death and a hole that a person lived with, sometimes for decades. The bioarchaeologist John Verano has spent years studying trepaned skulls from ancient Peru, where the practice was especially common among the Inca and pre-Inca cultures. His research found survival rates that seem almost impossible for surgery performed with stone tools, no anesthesia, and no understanding of infection. In some burial sites, the majority of patients showed healed bone. Not one attempt, sometimes 5 or 6 separate trepanations on a single skull, each one healed before the next was performed. Think about that for a second. A person lived through this once and came back for it again. Why would anyone do that voluntarily? Because the pain was worse than the surgery. If your head has been pounding for years, if pressure behind your eyes has never fully gone away, and someone offers a technique that has worked for your neighbor, your mother, your chief, you take the offer. Desperation makes brutal solutions look reasonable. And here's where it gets stranger. It wasn't only headaches. Ancient healers used trepanation for seizures, for head trauma, for what we might now call psychiatric episodes. Anything involving the head, involving the mind, involving behavior that seemed possessed by something unseen, got the same response. Open it up, let it out. The neuroscientist and historian Charles Gross, who studied the deep roots of brain science, described this as one of humanity's earliest attempts to treat the mind as a physical object. Not a spirit floating loose inside the body, but something located, something you could reach with a tool. That idea, that the brain is a physical thing you can act upon, is the seed of everything modern neuroscience became. Of course, they had no idea what they were doing to the tissue underneath. They weren't relieving migraines through some correct anatomical insight. Most of the time, they were probably just releasing pressure from swelling, or in some cases, simply giving the body a slow, agonizing placebo. But every so often, by accident, it worked. And when something works even once, word spreads. Word spread across the world, independently, in places that had no contact with each other. Trepaned skulls have been found in ancient China, in North Africa, across Europe, in the Pacific Islands. Groups separated by oceans and thousands of years arrived at the same brutal idea, again and again. Why does the same solution keep appearing everywhere? Because pain is universal, and the instinct to physically remove suffering, to cut it out, to release it, is written deep into how humans think about problems. You still see it today. You crack your knuckles to release tension. You press your palms against your temples when a headache builds, as if you could push the pain out through your skin. You're not that different from someone 7,000 years ago pressing a stone blade to their skull, hoping for relief. Physician Miguel Faria, who has written extensively on the history of neurosurgery, points out that some of these early trepanned patients weren't desperate strangers experimented on by outsiders. Many were treated by people in their own communities, healers who had performed the procedure before, who understood in their own limited way where to cut and where not to. There was a body of practical knowledge here, passed down, refined, even without a single correct theory behind it. That's the part that should genuinely surprise you. This wasn't chaos, it was a system. A crude, painful, terrifying system, but a system nonetheless. Trial and error, repeated across generations, slowly building something that resembled medical skill. Now compare that to your headache today. You feel the ache begin. You open a small bottle. You swallow a tablet designed by chemists, tested in clinical trials, manufactured under sterile conditions, backed by decades of pharmacological research. The pain begins to fade within the hour. No blood, no scar, no risk of infection, no permanent hole in your skull. It's easy to feel like you're simply lucky to live now, and you are. But look closer at what's actually happening. Your instinct, the very first thing you do when your head starts pounding, is still to physically intervene, to act on the body, to do something to make the pain leave. That instinct hasn't changed in thousands of years, only the tools have. Somewhere in your brain, wired deep beneath conscious thought, is the same impulse that guided a healer's hand 7,000 years ago. Something is wrong inside, something must be done about it. You are not so far removed from that ancient patient lying still, breathing slowly, trusting someone else's hands with the inside of their own head. The next time a headache builds behind your eyes, and you reach for a small white pill, remember what that motion really is. It's the newest chapter in one of humanity's oldest habits, confronting invisible pain with a physical act, generation after generation, tool after tool, until eventually, someone found a way that didn't require opening the skull at all. Right now, somewhere in your skull, a headache might be building. And for the first time in the entire history of your species, the cure doesn't have to hurt at all.